Looking for something that's still reliable for birth control, of course, generally all of your hormonal birth control options are still out there for you. And really what affects whether or not you're able to take those hormonal options is more personal medical history, sometimes GYN history. But if you otherwise don't have other risk factors, most of the hormonal options are very safe, really up until menopause. So a lot of people, when they're finished having children, will elect to do something longer acting, like the Nexplanon implant in the arm, or what's very popular is the progesterone only IUD. People love the IUD because it is something you don't have to think about. It's effective up to 7 years. And it also has the sort of added benefit of decreasing bleeding with periods. Some people don't have periods at all. If you're at least 6 weeks out from delivery, you would have the option of a tubal ligation. Most of the time when we do a tubal ligation now, we're actually removing the entire fallopian tubes. The reason for that is A, you're not using them anymore, and then B, you are potentially decreasing your future risk for ovarian cancer, as some forms of ovarian cancer may actually originate in the fallopian tubes. That's a laparoscopic procedure. It's a same-day procedure, and most people go home and recover very quickly from that. The other option that people sometimes forget about, but is a very viable option, is if your partner is a male, vasectomy is always a great option as well. And you know, a lot of the worries about hormonal birth controls were centered around increased risk for certain things with estrogen-containing pills. But that was also in the time where estrogen-containing pills had a much higher dosing in birth control pills. Essentially, all birth control pills made now are considered low dose, which means their overall risk for things like blood clots or stroke is very, very low. And to put it in perspective, it's significantly lower than your risk for blood clots or stroke pregnancy. The things that really change whether or not you're a good candidate for certain birth control methods are sort of what risk factors you have yourself. So if you have high blood pressure, if you have a history of blood clots or stroke, if you are somebody who has some sort of a GYN anatomic abnormality, certain types of birth control may not be good for you. People who are smokers are at higher risk for blood clots. So especially if you are over 35 and you smoke or have the other conditions that I mentioned, certainly estrogen-containing birth control options may be off the table. But that doesn't mean that progesterone options aren't still available to you, and there are several of those. As far as sex drive, libido in general, we don't really notice a major change with a tubal ligation. And really the reason for that is because we're not changing what the ovaries are producing. We're not changing your normal hormonal flow. So you would still expect to have the same changes in your hormones throughout your menstrual cycle that you had prior to having a tubal ligation. The major change is just that the tubes are either blocked or not present. Some people do feel like they have heavier periods or potentially more painful periods after tubal ligation. But then a lot of people don't necessarily notice that. So that's sort of person to person a change. The thing to know about that is that if you do have a tubal ligation and those things become an issue, again, you still have hormonal options and surgical options available to you. One of the most common questions that we get is, I want my hormones checked, which sounds like something that's easy to do and that could give you a lot of answers, but really isn't very beneficial as a lab marker for us to determine what to do for management of certain symptoms. So your hormones change all throughout your cycle, and the the range of what is normal for various hormones is so large that it isn't very beneficial for us to get a number and then treat based off of that number. So more so what we encourage people to do is to talk to us about symptoms that they're having as they get closer to the age of, say, 50. Now, we all know that menopause doesn't happen at the same age for everybody. The average age is around 51 or 52. But if you're in your 40s and you're noticing that you're having an increase in hot flashes or night sweats, you may be experiencing changes like hair loss, some mood changes, sleep disturbances. Those would all be reasons to at least check in with your gynecologist to see if there is something that can be done to help with those symptoms. In most cases, if you are not already menopausal, then what's most helpful for some of those symptoms tends to be hormonal management in the form of birth control. Because if you use hormonal dosing if you use menopausal dosing of hormones in somebody who's premenopausal, it's unlikely to be effective for them. There are also non-hormonal options for managing menopausal symptoms or perimenopausal symptoms. So don't think that just because you may not be a candidate for hormones that you shouldn't talk to your doctor about those things. We see so many women who come to us, for example, for their well woman exams, and they offhandedly mention, oh, I had this odd thing happen with my period. And yes, sometimes it's normal and other times it's not. It could be a red flag for us. So the reasons that you would want to talk with your gynecologist, especially as you're heading into that perimenopausal, menopausal time, are if your periods become more frequent or closer together, if you're having bleeding in between periods, or of course, if you're noticing that your periods themselves are heavier or longer, because that could mean that there's something structural going on, like a fibroid or a polyp in the uterus, that really isn't necessarily related to menopause at all, but is something that should be addressed. Okay. If you are having regular periods still without other symptoms, then that's great. But sometimes what we'll hear is, you know, it's really weird, for the last 4 months, I've had 2 periods a month, and I assume I'm just perimenopausal. But in general, we don't consider that a normal pattern as you head into menopause. What would be more normal is for your periods to start to space out if they were previously regular. With that being said, if you're somebody who has irregular periods baseline, make sure that you've been evaluated for that, because that can increase risk for other issues down the road.